Joel. I'm here with my friend Jason. Jason is a personal trainer, metabolic specialist, and he has been working with the Theragun. I have yet to actually, I've seen it on pictures and whatnot, but that's about it. So we're gonna crack this open. So tell me, what do we got here?
So we have the Theragun G3 Pro. This is Theragun's highest level model that they offer. This has the articulating neck, it has the removable battery, 2 speeds, multiple attachments.
Is the 2-speed, oh, here we go. Okay, so this thing is quite big. So I was thinking something that was like half the size. So this is definitely a big deal. So here you go, there's the Theragun.
So as I said, it has this articulating neck here, so you have a variety of angle that you can adjust the head to. It has a triangle shaped handle to it, so it gives you a variety of different grip methods, specifically to kind of get into awkward positions such as your back. So from the bottom side, we can get back here. Usually we'll manipulate some.
So is that the head that you like to use? Because we've got...
there's a multitude of heads. This is the dampener, and then there is a small ball, a large ball, a wedge, a cone, and a thumb. So depending on how precise you're getting into a specific...
This is the thumb right over here?
That's correct.
Okay. And then the big one over here. Wow, that thing's huge.
Yeah, it is.
Okay, so what does it mean dampener? Does it like decrease some of the force, or what's the deal?
It just spreads it out. It's more of a flat head. It's
gotcha,
got a slight ball, but it's more flattened than it is round, as you can see.
Okay,
here.
all right, okay, that makes sense. Cool. Yeah, and this looks like you're kind of chiseling away.
Yeah. The dampener's more of an all-purpose head, so that's why this one's on here now.
So this is kind of interesting. I have a left shoulder problem, and I'm getting weird symptoms, even down through trigger points in my arm. A common area for trigger points is the infraspinatus.
Yeah,
so this muscle. So go ahead and turn that way a little bit over there. We'll kind of look. This muscle fills the bottom part of the shoulder blade. So it goes from that direction, wraps around, and attaches to the head of the humerus or arm bone. Okay, so that muscle is basically my hand, and the trigger points are decent right through here. So if you can't dry needle your own shoulder, which we're actually going to do some dry needling on Jason through here, but let's look at the Theragun first. So go ahead, and how would you use that?
So I would kind of get a neutral position on the head here, and then use the lower portion of the Theragun in order to get myself.
Okay, so you're kind of doing that. So this is almost like a Theragun type thing.
Right.
Okay.
And then avoiding direct impedance, but getting more of an angle on it.
Now, when you do that, let's go ahead and let's turn it on. Let's see what we got.
All right.
Okay. So you can also use a mixer, I think, as long as you had the right head for it.
Right.
All right.
Jigsaw.
Okay. So this is kind of more of like a massaging thing. Okay. Yeah, right through there. And it looks like there's a lot of force going through with that.
Right.
And so
I would give another speed.
Okay, good. That to me looks like a little bit more comfortable.
Yeah, it is.
And you can see the vibrations going right through them. Okay, cool. Mind if I try?
Sure.
Okay, so that's the on button right over there. This is the first infraspinatus. Okay, so you said right over here?
Grab it the other way.
Like this?
Yeah.
Okay.
Gives you the best kind of mobility and reach with that particular position.
Man. Actually, that is.
Nice.
That is kind of...
Drop that.
I'm thinking power tools, blender.
Jigsaw.
Yeah. Hey, a jigsaw. Now I'm going to make something. Theragun with your jigsaw. There we go. Actually, that is kind of cool. Now, one area to go is actually between the deltoid. Right between the deltoid. So your posterior deltoid comes around. Now, what happens when the infraspinatus is having trouble because we have that shoulder dyskinesia, the abnormal movement. So way back when we looked at you, you had a restriction to the ball and socket, and it was grinding away at the rotator cuff, and we confirmed that with diagnostic ultrasound. We also confirmed that things were intact, that your repair was intact. We can see the infraspinatus tendon with the ultrasound. Yeah, here is that trigger point. There is you can kind of see, oh yeah, right across through there. When this muscle develops trigger points and it's not working as well, the posterior deltoid starts, and the middle deltoid back portion starts taking over. That's better. We did some dry needling on this. We're gonna go after that today, okay?
Sounds good.
So dry needling to that. The other thing in that area, you can also use the Theragun for that as well, and we'll show you that.